The term health equity is about making sure that all areas of the population have the opportunity to be healthy and live their best lives. The Health Plan of Nevada is working to improve the health of every community across our state.
Absolutely. Kelly Simonson. She is the president of Health Plan Nevada's Medicaid plan. She joins us now from her office. How are you, Kelly?
I'm fine, Sean. How are you?
Doing very well. Let's talk about health equity, what this means to you, and how Health Plan Nevada is trying to make this a reality.
Absolutely. So, health equity really simply is about helping all people from every economic background to live their healthiest life and to achieve their maximum wellness. And we can do that by eliminating the unfair differences that exist today in the way people access and receive their health care.
Yeah, absolutely. Let's talk about what some of those differences are and how it is that you go in and help improve people's situations.
Sure, absolutely. So we really support health equity in a number of ways. We recently have supported local food banks, and we have made some significant investments in affordable housing. And we partner with community based organizations and faith based organizations that also work to eliminate these disparities as well as other challenges that people experience, like um, uh, transportation issues, financial stressors that they have in their lives. And we believe, because Health Plan of Nevada is a local organization, that we really know our members well, we know our communities well, but we also have the strength of our parent company, United Healthcare, who's dealing with health disparities and health equity across the country and globally, and they can bring those solutions to us locally, and then we can customize those for our unique market here in
Yeah,
Nevada.
absolutely. Let's talk about the markers, the social determinants that play a role when it comes to health equity. Obviously, poverty has got to be one big one. What else would there be?
Right, absolutely. So, social determinants of health, and we define those really that there are three key social issues that affect healthcare, and that's lack of transportation, lack of stable housing, and lack of nutritious food. And what we find is that 80% of healthcare is really not driven by clinical care, but it's driven by the social determinants of health. And that is why we are developing proven solutions in our market to address those key areas of secure food, secure transportation, and secure housing.
Yeah, and speaking of some of the things that you've done here in the local community, maybe you could talk about some of the specifics of your initiatives that have really, helped serve some of the underserved populations.
Absolutely. So, first and foremost, we have a community health worker program. And in this program, we hire individuals who represent many of the underserved areas of the Las Vegas community. And we partner these individuals with our members who live in those areas. So, they're really field based workers. And they develop a trusting relationship with the members who live in these communities because they have had similar experiences. They have similar healthcare experiences, similar social economic backgrounds, and they can help our members improve their access to care, help them to get to the doctor, um, reduce the amount of non-emergent use of the ER. And that's been a very successful program for us. In addition, we've made some large financial contributions. We recently announced a $250,000 grant to the Southern Nevada Health District's federally qualified healthcare center
Nice.
to address health equity issues in minority women. So, really focusing on
Mm.
breast cancer screenings, cervical cancer screenings, and elevating the number of women who receive those services. We also last year announced a $1 million 3-year grant to the Catholic Charities of Southern Nevada
Mhm.
to address food insecurity and connect formerly homeless men with jobs and stable housing.
Awesome. Well, it's great work that you're doing in the community. I know that Medicare open enrollment ends at the end of the month, so now's the time to get moving. It's great having you, Kelly. Thank you for
Thank you,
joining us.
Kelly.
Thank you. Take care.
healthplanofnevada.com. You could also go to myhpnmedicaid.com or call the number you see right there on your screen. Health Plan of Nevada, proud sponsor of the Morning Blend.